are hesitant to receive the vaccine for several different reasons. First, we have people who are generally hesitant about all vaccines, not just for COVID, but for a variety of different infectious diseases, and even diseases like measles that are much more deadly than COVID. It's going to be very difficult to convince these folks to be vaccinated. Difficult to convince them that it's worth a small personal risk for a great public health benefit. There are also people who may be reluctant to be vaccinated because they simply believe that the risks of the vaccine outweigh the risks of COVID for them personally. We've all heard by now that there have been a few really bad reactions, not very many, but a few. But more commonly, we've been hearing that the second dose makes some people feel really bad for a day or two. So people who don't perceive themselves to be at risk of severe disease or death from COVID, or people who believe that getting COVID is just not that bad, maybe they've known someone with a mild case who got better very quickly, they may think that getting the vaccine just isn't worth the risk. But the risks of COVID are much greater than the risks of the vaccine. Lastly, there are people who might want to receive a vaccine for COVID-19, but who are also concerned that this vaccine or the couple of vaccines that are currently available aren't safe because they think that the research was maybe rushed and perhaps the data from clinical trials of the currently available vaccines didn't receive thorough and appropriate review from the Food and Drug Administration. In my opinion, and in the opinion of other people who know a lot more about this than I do, like Dr. Fauci and other leading scientists, the available vaccines have been shown in clinical trials to be both safe and effective, and we should trust the data and trust the process. But there's always a risk to any vaccine, and people need to weigh their own personal risks of experiencing a vaccine-related adverse event against their personal risk of contracting and getting really sick with COVID. They should also consider their personal values regarding what risks they are able and willing to take for the health and well-being of their families and their neighbors and their communities. My suggestion is that anyone with concerns talk to their personal physician.